Hey, I'm your host, BKP. Good morning from beautiful downtown Blue Ridge, and today we're at Sycamore Crossing, and we have Congressman, the 9th Congressional District of Georgia, Congressman Doug Collins online. Congressman, how are you this morning?
I'm great, Brian. How are you?
Doing great. I know you only have like 7-8 minutes, so let's start first and foremost with everything taking place from FBI Director Comey to special prosecutor to Russia collusion on the daily events that some of the media feel is the most important thing to talk about. Has that changed your support in any way for the President of the United States, and where does Congressman Doug Collins stand as far as supporting President Donald Trump?
I'm in full support of the president. I think all these issues right now are being driven by a media and also Democrats who want to, who have never viewed this president in a positive light, who do not like the fact that for 7 years the American public has voted consistently to keep the House and then the Senate in conservative hands while getting rid of Hillary Clinton in the last election because we were tired of the liberal policies of health care and Dodd Frank and all these other issues. This week, and I would encourage folks to go to my Facebook page, go to my YouTube page, and look at some of the interviews we've been doing and basically pushing back on a lot of this issue. What the media right now is simply trying to find palace intrigue because they don't want to talk about what we have done, where 28 bills have been signed by President Trump, 13 Congressional Review Acts have rolled back Obama-era regulations. We passed in the House the repeal and replace of Obamacare. We began the framework for tax reform. This week, our office dropped a VA expansion choice bill, which will give our constituents better access to private health care when the VA can't provide it. Brian, there is a focus up here among myself and among many others that are saying, let's get this stuff done. We've been given a historic opportunity, and the president, is there to lead, and we're going to be there to support as we move forward on these conservative agenda.
Congressman, first of all, let me apologize for any background noise, but that's called rural America. We're in downtown Blue Ridge. We've got trucks running. We've got weed eaters going. So we like this kind of noise, opposed to sorry that you have to be there in D.C. to that kind of noise. Healthcare. Could you elaborate on why the bill has not been sent over to the Senate? Could you clear that up? I read an article that waiting for a CBO score and waiting for a couple alterations that possibly need to be made so that it could go through a reconciliation process in the Senate. Could you tell us why that bill's not over in the Senate being debated at this time?
Well, let's clarify something. It's the reason we haven't sent it over is we have to send it with a CBO score to the Senate. And that's to meet the rules of reconciliation for debt reduction. We knew this was going to happen. This was not a surprise. We did this intentionally because we knew we needed to get the CBO score done. We had the votes. We went ahead and had the votes. And we feel very confident the CBO score is going to come back with the amounts that we need to go ahead and send it over. I talked, in fact, just this morning, talked to the Speaker of the House about it, and Paul and I were discussing it, and we still feel very confident in where we were. It just takes the CBO a little bit of time to get this score done. There's no hidden agenda. Think Progress, I think, first put this out yesterday. I mean, again, Think Progress does not want us to repeal and replace Obamacare. So I think what we're focused on right now is this has been the plan from all along because we had to meet the requirements of reconciliation. And hopefully by the time in another week or so we'll have that score. The actual bill will be sitting in the Senate. But believe me, the Senate is already taking this up. The Republicans in the Senate and even some Democrats talking about it, but the Republicans in the Senate are already thinking about how they can put this package together, and we're moving forward on repealing and replacing Obamacare.
All right, just to clear up the article that I read this morning, when the CBO score comes out, this is not going to put this in a position to where actually the House has to re-vote on the bill. That's the first part. And the second part, could you, if you haven't already, could you one more time explain why it's important to send it over where the Senate could pass it under reconciliation instead of the normal rules of the Senate?
Yeah, not a problem. No, we don't expect to have to revote this at all because we expect there to be plenty of buffer, even with the last changes we made that had to get the new score. We had already had significant savings in this bill to start with on deficit reduction, so we don't expect to have to do anything else. I mean, if for some reason something came back, I mean, we'd address it at that point. But at this point in time, we don't expect that. We never have expected that. We'll see where it goes. The reason this is important is because we're doing this under the 51 votes in the Senate, not the 60 cloture. That means that we can take this to the floor, we can get it passed with Republicans, and make sure that this bill gets to the president's desk or comes back to conference more than likely so that the two bodies can finish up a bill that the president can sign. That's the reason that we're waiting. That's the reason we're being patient. And again, if you liked Obamacare, if you like government intrusion into healthcare, if you like a government that tries to run everything, then you're going to be a media that's going to put out every falsehood you possibly can to get us off track. So, I mean, at this point in time, I'll let them run around in circles being Chicken Little. We're going to focus on what matters, and we're going to continue to get their job done.
Tax reform. It doesn't matter what article you pull up. Everybody has a different date, different time. When we think we'll see tax reform, we'll see one article says 2018. The next article says after the summer. When do you think you're working on it? When do you think you'll actually have something to vote on and send over to the Senate as far as tax reform is concerned?
I think it'll be sometime this year. I'll probably shooting. I think you'll see a lot of it come together. Healthcare we've got to finish up. There's also a budget reconciliation for 2018 that we have to pass so that we can do the 51 vote again on tax reform as well. So that's coming up in June, and we'll see how that goes. So I'm looking sometime before the end of the year, and I think it could be part of a bigger process of legislation dealing with some other areas as well. But I do believe that we'll see tax reform this year. That's my desire. That's the desire of a lot of folks up here, is to go ahead and get this done this year as we go forward before unfortunately before the election cycle starts again in earnest in January of next year.
My final question, we've been talking about a couple things that impact this big, great country of ours, but let's bring it to the 9th District. What is some of the legislation or some of the things you're working on in the House right now that directly affect the 9th, that runs under the radar screen that just we don't see every day here in the 9th District, or it's not reported on?
Well, I think some of the things that we're working on is some of these that we've talked about. We've got a bill coming up that's going to directly affect the Dodd Frank Act, which has been devastating to banks and capital in Northeast Georgia and our smaller communities. When we understand those kind of things that affecting health, affecting our banking system, affecting our community, that's going to be coming up in June of this, in the next couple of weeks. We've also been working on the VA. We've also continuing, as I said yesterday, I couldn't be more proud of our staff and the staff not only in D.C. and the staff in Washington that is, really looking to find solutions. And one of our constituent service guys, David, in our district office, found a need through a constituent on how we can better help veterans find the health care they need, and if they can't find it at the VA clinic, then not having to drive multiple hours to get somewhere it can, find it in the local community. Again, we've been working on, this has been Police Week, we've been working on strengthening our support for our law enforcement. Next week is Human Trafficking Week, in which we're going to be, again, working on something that has affected Georgia directly and Northeast Georgia directly, because Atlanta and that surrounding areas had become, over the past few years, a human trafficking hub. And so these are the kind of things that we're working on every day, in addition to the big items like healthcare and budgets and those kind of things that affect everybody, directly as we go forward. So we're excited about where we're at. And again, this doesn't get reported because it's not sexy. It's not the things that they want to report about. They'd rather report about palace intrigue than actually report about the things that we're actually trying to get done up here.
Well, Congressman, that's why we appreciate every couple of weeks you come on and you update us on some things, and we try to clear the way for actually the 9th District and the voters here and the citizens in the 9th District to get to hear some positive things going on that are happening behind the scenes. So in your close, Special Prosecutor, all of this dirt on the top is not affecting Congress from moving forward in some productive ways for the American people?
No, I mean, look, is it a distraction? Yes. Is it something that the media is going to continue to hype and Democrats are going to continue to wail about? Yes. But at a certain point in time, Congress we've been investigating Russia through 5 different committees on the Hill. Now the FBI has decided they wanted to use the special counsel. Fine. We're going to continue what matters to the American people, and that is making sure that when they get up every day, government is less intrusive, government is more productive in making a growth economy instead of a stagnant economy, getting health care back where people can actually have access to affordable health care and not have access to health care that is just simply health insurance and not health care. These are the kind of things we're working on, and as we move forward in that, we're excited about that as we go forward.
Congressman, we appreciate you very much, and we thank you for always opening up and giving us this opportunity to talk to you. I have to say, you can enjoy Washington, D.C. as much as you possibly can. I'm going to enjoy Blue Ridge, Georgia today.
You better go to Joe's and get some barbecue.
I was wondering how long it would take you to tell me that. Congressman, I appreciate you very much. Thank you, sir.
Take care. Bye-bye.
Okay, that's Congressman Doug Collins, and I wanted to get an opportunity. We hear Russia, Russia, Russia 7 days a week, 24 hours a day. I wanted to get an opportunity for the congressman to actually share with us what's going on with tax reform. He thinks they'll have something before the year is out over to the Senate. They have to have a CBO score. They have to have a CBO score so they can actually do reconciliation. That's 51 votes in the Senate. We'll talk about that with our all-star panel at 9. I'm going to go to break, and next up, Ask the Doc with Dr. William Whaley. We want to thank the Georgia Cancer Specialist for our next segment. Sam, take us to break.